Hello, everyone. Thank you so much for tuning in. Are you aware that October is Breast Cancer Awareness Month? And so we're encouraging you to perform self-breast exams monthly and get screened. Now, most of you are thinking, breast cancer only happens in women. But I want to inform you that breast cancer also can happen in men. And so we are encouraging you to take note and to be proactive in your health. Did you know that there's 1 in 8 women will be diagnosed with breast cancer in their lifetime? Breast Cancer Awareness Month, also referred to in the United States as National Breast Cancer Awareness Month. It is an annual international health campaign organized by major breast cancer charities every October to increase awareness of the disease and to raise funds for research into its cause, prevention, diagnosis, treatment, and cure. The Witness Project goals wants to educate and raise awareness about breast and cervical cancer, risk, early detection, and prevention, especially for African American women. The risks have changed. To increase breast and cervical cancer screening among African American women, and also to encourage African American women to be proactive about their health. Now, what is cancer? Well, cancer is a group of more than 100 different diseases. Cancer affects the body's basic unit, the cell. Cells become abnormal and divide without control or order. There is no one pathway that leads to cancer. The causes of cancer are complex. Let's talk about breast awareness for mammograms. Stay aware of any breast changes, especially if you're under the age of 40, and perform regular BSE, which stands for breast self-exams. Now, what is a mammogram? Well, it's an X-ray picture of the breast. It detects breast cancer before they can be felt. And then mammograms machines, they take pictures of both breasts. Now, what happens during a mammogram? Well, the breasts are compressed to make the X-ray clear. This can be uncomfortable, but it is necessary. And one other thing to note, always get your results. Now, regular mammograms starting at the age of 40 is appropriate, but your provider may recommend that you start having breast mammograms at age 35, especially if you have dense breast or a family history of breast cancer. And then ages between 44 to 45 every year, and age 55 and older every 2 years, or continue your yearly screening. Now, there are some warning signs of breast cancer: swelling, warmth, redness or darkening of the breast, change in the size or shape of the breast, lump, hard knot or thickening inside the breast or underarm area, itchy, scaly, sore or rash on the nipple, dimpling or puckering of the skin, pulling in of your nipple or other parts of the breast, nipple discharge that starts suddenly, new pain in one spot that does not go away. If you notice anything that is not normal, contact a doctor immediately. Now, breast cancer preventive measures, what you can do? Well, you can start participating in a healthy diet. Limit alcohol intake. Limit or minimize use of hormone replacement therapy or the pill. Healthy lifestyle. Get plenty of exercise and rest. Reduce exposure to harmful chemicals. Know your family history. And be an advocate for your health. Get screened. Get cancer vaccines for your family. And do regular self-exams, breast exams, and notice unusual signs or symptoms. Now, there are some signs and symptoms of cervical cancer. Cervical cancer is an abnormal cell growth in the cervix. And you can identify that by irregular vaginal bleeding, after intercourse, between periods, or after menopause. And also there could be vaginal discharge, unusual color, watery, bloody, or heavy, has a foul odor, pelvic pain, or pain during sex. But frequently, there are no signs or symptoms. Now, the average risk for women, if you are between the ages of 21 and 65, it is recommended that you be screened for cervical cancer at least every 3 years with pap tests. Ask your doctor about HPV testing. You may be able to go longer. If you have had HPV or an abnormal pap test results, you may need annual pap tests. And one of the things to understand is that if your test comes back abnormal, your provider is responsible for notifying you. They may notify you by telephone, postcard, or letter. And don't ignore the letters. Please follow up with your provider. Now, did you know that the death rate by race is 4 per 100,000 people? African American is 41%, and white people is 2.1, and for all other races 2.3. But I want you to know it is virtually 100% curable if found by pap test in precancerous state. Let's talk about the risk factors for cervical cancer, HPV cancer, and the vaccine. HPV equals human papillomavirus. Having multiple sexual partners, age over 40, it's a highest death rate. And smoking cigarettes, the risk is twice as high. Long-term use of oral contraceptives or birth control pills. History of sexually transmitted infection or HPV infection, vaginal, anal, or oral sex. Now, the HPV vaccine, it's safe and is similar to other adolescent vaccines. And for boys and girls starting at the age 9, it is recommended. Did you know that 79 million Americans are currently affected with HPV? It's the most common STD infection. And the main risk factor is cause for cervical cancer. But I want you to know the vaccine is working. So be proactive and use this vaccine. Now, why is the death rate or mortality rate so high for African American women? Cervical cancer is 100% curable if caught at the very early cellular change-like level, like a PAP. Majority of cervical cancer deaths are in women aged 40 years of age or greater. Women 40 years of age or greater, past childbearing years, they usually quit getting their PAP. Now, while childbearing, they're more worried about pregnancy and taking birth controls. But did you know that in order to get birth control, you have to get a pap exam? Black women are twice as likely to die from uterine cancer as white women, and 41% more likely to die from breast cancer, despite similar or lower incident rates. Overall, black women have an 8% lower cancer incident rate compared with white women. Specifically, black women are less likely to be diagnosed with breast cancer and lung cancer. However, black women are more likely to be diagnosed with stomach, liver, and pancreatic cancer, all of which have low survival rates. Now, let us talk about why there is a disparity with why there is a disparity. The reason for racial disparities is largely driven by decades of structural racism leading to a higher risk of lower socioeconomic status. Reasons for continuing disparities are complex or likely rooted in structural racism, which contributes to inequalities in the social determinants of health, including access to care. Socioeconomical differences are linked with having more risk factors for cancer and other diseases and less access to high quality and timely cancer prevention, early detection, and treatment. The main cause is inadequate health insurance. Because of such issues and barriers, black people are more likely to be diagnosed with advanced stage disease, which is usually more costly and difficult to treat, more likely to experience delays in treatment, and less likely to receive recommended treatment. Now, higher death rates from breast cancer among black women are also likely related to high prevalence of obesity and other health problems, higher incidence of triple negative breast cancer, which is aggressive and challenging to treat. Black women are twice as likely to be diagnosed with triple negative breast cancer than white women. They're also 30% more likely to die from these tumors because of lower rates of surgery and chemotherapy, higher incidence of inflammatory breast cancer, and aggressive but uncommon type of breast cancer. Now, there are some myths about inherited breast cancer. If I have a genetic mutation, I can't do anything about it. I'll probably just get cancer one day. A woman can't get the mutation from her father. And only women with family history of breast cancer are at risk. But I want you to know those are myths, and these are just not true. Here are some summary and take-home points. For African American women, please be proactive about your health. Risks for breast cancer have changed, and there are cases of breast cancer rates that have increased. Having more children can increase breast cancer risk, but breastfeeding can reduce those risks. Cervical cancer incidence and death rates are still higher than for whites, especially among African American women. HPV spread by sexual skin to skin, anal, oral, and vaginal. And then there is the HPV vaccinations. They do prevent cancer. So we do urge you to get vaccinated and to be proactive about your health. And then the breast cancer in men. Male breast cancer is rare, but generally overlooked. In 2009, the Male Breast Cancer Advocacy Group Out of the Shadow of Pink, A Man's Pink. Then there was the Brandon Greening Foundation for Breast Cancer in Men joined together to globally establish the third week of October as Male Breast Cancer Awareness Week. Now, I want to thank you for tuning in. The Witness Project wants you to know your family health history, advocate for your health, get screened, get cancer vaccines for your family. Thank you all again for tuning in. Don't forget to like this video, to share this video, and then to subscribe to the channel. Leave your respectful comments below. If this video was helpful to you, I'm sure it'll be helpful to others. Thank you all again. Have a blessed day.